Hi, welcome to Medicare Simplified, a podcast by Sanford Health Plan to help you decide which Medicare options are right for you. I'm your host, Courtney Collin. When choosing a Medicare plan, it is not one size fits all. Everyone should choose the option that best fits their needs and lifestyle, and it's good to understand all the benefits that are available to you beyond health coverage. One of those is retiring and how our habits can make the process difficult. I have Dr. Jonathan Alagata, who is a psychologist at Sanford Health in Fargo. Dr. Alagata, welcome.
Thank you, Courtney. Thank you for having me.
So let's start with this. Why is it so hard for some individuals to retire?
Well, Courtney, I think that there's probably two things to think about. First, I think is resources. Some people are going into retirement being more financially secure. Social support is in place. A lot of things are pretty solid for them in that transition. Whereas for some people, they may not have the financial resources. Maybe they've lost a spouse. And so there's some thinking in the literature that part of what makes the transition difficult is whether or not people have a certain amount of resources to help them out. But the other thing that I think is also important to think about is that I also think we spend a lot of time, retirement is kind of dangled that after a lifetime of hard work, then you get to just kick back and relax. Well, we've also practiced getting up on time, working with coworkers, and my sense is that a lot of the needs that people have are being met in the context of work, and so when they transition to retirement, some of those needs might have been hidden to them that they always just got with work, and so understanding what our needs are, I think, is an important part of the process, and to the extent that we didn't realize what those needs were before retirement, I think that can make it a little bit more of a challenge.
So in addition to understanding what those needs are, what can we do to overcome habits or challenges that have made retiring difficult?
So I think the first thing is to really just look at retirement as in an optimistic way, as a time to meet some of those needs. I think the literature would say that there's three needs that we have as human beings. One is for support, social support. One is to do something and do it well. And then a third one is to have choice. And so to the extent that we are able to have those needs met, the better, it bodes better for us. And so I think, looking at retirement as a way to meet some of those intrinsically held needs is a real opportunity versus, I've got nothing to do. So I think this is a moment for people to reflect on some maybe unmet needs that they never got a chance to really meet and do and really go for it.
If we're nearing retirement or just starting to think about that timeline, what can or should we do to prepare ourselves to begin that next chapter in our lives?
I'd say, as odd as it might sound, and I'm pretty sure that no current employer would allow somebody to take time off to pretend to be retired for a little bit. But I think I'd encourage people to think about that lens. If I were done working right now, if I really had the flexibility to do whatever I want right now, what would that be like? And I think for some people, that's not hard. Some of the introverts out there probably feel like, oh, this is great. I can finally do the things I want to do. And I think that's awesome. My guess is that some extroverts out there might not fully appreciate how much work connects them into society and in life. And so pretending for a moment that they're going to be retired, and what if work went away? What kind of relationships would you miss? What kinds of things would you miss doing? Did you really love your job because it was really reinforcing, it helped you have a sense of accomplishment? Do you like your coworkers and you really like to associate with them, but you don't necessarily hang out with them after work? And so if that goes away, and then you're doing this for the next X amount of time, what would that be like? Would it be okay, or would that be really tough? And I think a lot of people go into retirement thinking, great, I'm not going to have the to deal with the hassles of deadlines and things like that. And so those are transitory as far as this process is concerned, stressors, probably not reflective of what life will be like afterwards. And so if you're not retiring into something, back to the idea of that people have a need for competence, I think hobbies are one of those things that can be a need for competence. And so to the extent that you can line those up ahead of time and feel like you're not just getting away from the work life, but you're actually moving into another period of time where you get to have these other needs met, I think that's a better outlook to have than just, I need to be done with work. So really think about what would it be like to not have all these supports and resources, and have to start again. And if people are not sure what that would look like, then now would be the time to kind of get an idea what that would look like moving forward and try to build it up before they have to retire.
Yeah, that's great advice and practical too. Thank you. If we're not retiring soon, but we hear this conversation and we think of a loved one who is, what are some ways we can support them in making that decision or making that transition?
Yeah, that's such a great question because everybody's so unique in the way that they probably approach and then respond to the retirement process. Having a little bit of help probably would be good. And so I think first of all, I'd really encourage loved ones to just be on alert for some emotional changes. Now certainly I think that there's probably going to be a little elation right away. Wouldn't be surprised if everybody post-retirement is doing well for a fair number of months, maybe 3, 4, 5, 6 months. But I guess if you start to see, after a 6-month period, that this person seems a little bit more agitated, a little restless, maybe a little bit down, just maybe not a sense of being on their best self, that's probably a hint that this is not going well. And so if that's the case, then I think trying to encourage a little raised awareness of that. I think it's not uncommon for that I've heard, at least, and maybe that's partly a clinical setting, that I'm retired. I don't have anything forcing me to do anything. How come I'm not having a better time? And so I think if you're a family member, you want to be alert to those changes in mood, but then start to as much as possible bring in the conversation about meaning, about connection, and about a sense of intrinsically rewarding activities. And that's the key thing, because there's been some research that says that if people are feeling a duty and forced to volunteer, it's probably not as healthy if they weren't doing that. But if people are feeling very motivated and doing stuff that they love, it's a lot better. And so I think as a loved one, I'd want to be attentive to, does this seem like they're doing things that are expressions of who they are? And if they're not, they might not be the happiest. And so to the extent that you can encourage a conversation around that and nudge them to do the things that they love, I think that's probably for the best.
It is a big decision, and with that, there's a lot to think about.
The biggest thing is it's a great opportunity to find another part of yourself, and being approached in that way, I think it certainly sets you off on a better footing.
Well, Dr. Alagata, thank you. Such great information. We so appreciate your expert insights and guidance on this topic.
Thank you.
If you'd like to learn more about Medicare Advantage plan options from Sanford Health Plan, visit align.sanfordhealthplan.com or find more information in our episode show notes. Thanks for being here. We'll see you soon.